thank you so much for joining us today. We're here with Health Officer Dr. Jennifer Vines, Public Health Director Jessica Guernsey, and Communicable Disease Manager Lisa Ferguson. Our speakers are just going to give a brief update of local disease trends, but really this is a time for you to ask questions. So with that, I will turn it over to Dr. Vines.
Thanks, Kate. Hi, everybody. Yeah, Dr. Jen Vines, Multnomah County Health Officer. Thank you all for being here today. We don't have a particularly big announcement. We just want to acknowledge the difficulty of the time that we're in at this particular moment of the pandemic. There's a lot of anxiety. Things are moving very quickly. And we just want to be available, mostly for your questions, but also with some short updates of our own. So this is the first of what we think are going to be weekly updates like this. So again, thank you all for being here. I'm going to talk just briefly about disease patterns. I'll turn it over to Jessica Guernsey, who will talk a bit more about how we're responding. And we're glad to have Lisa Ferguson here to speak to some of the technical pieces of our COVID work. So I don't need to tell you all the COVID case numbers are eye-popping in the several thousands statewide, with Multnomah County averaging about 1,200 cases a day. Again, these are cases coming to us through the formal established lab reporting systems. These are not reflecting the increasing number of at-home tests that people are doing. Our own internal disease trackers or epidemiologists are projecting that probably half of the Multnomah County population will be infected with Omicron between approximately mid-December and sometime in February. So that speaks to just how quickly this virus moves. There's a lot of speculation about whether we're at or near the peak in cases right now. We might be, but it's really hard to say. And we're frankly still quite concerned about hospitals. So remember that hospitalizations tend to lag infections by a few days. So we're watching hospital capacity carefully along with our health system partners. What we increasingly understand about Omicron and what Centers for Disease Control has published formally is that it does appear to cause so-called milder disease, meaning that things like how long people are hospitalized, whether they need intensive care unit admissions, whether they succumb to the infection, that all seems to be lower than at previous points in the pandemic. We know very well how quickly Omicron spreads. We also know that it gets around some of the more superficial protections of our vaccines. So about 2/3 of Multnomah County cases are breakthrough, with another 13% breakthrough cases among those who are boosted. I am not surprised by those numbers based on what some of the early reports were about Omicron and how well it could get around those initial protections from vaccines. The really good news is that the vaccines continue to hold up against severe disease and hospitalization. So that is key. That is even more true for people who have gotten boosted. Again, people who are 5 months or more out from their second dose of Pfizer or Moderna. So we continue to strongly recommend boosters. We acknowledge that it's a difficult time in terms of very complicated isolation and quarantine guidance. Our main message is to be vaccinated, stay home if you're sick, and wear a well-fitting mask when you're indoors around others. And just know that this is a difficult time and we are here with you to get through it. Let me turn the microphone over to Jessica Guernsey, our Public Health Division Director.
Thanks, Dr. Vines. Hi, everybody. I'm Jessica Guernsey, Public Health Director. I use she, her, hers pronouns. It's a pleasure to be with you all today. Just wanted to hit on a few other points and then really open it up for questions. As Dr. Vines said, in a time like this where we're managing through rocky transition through Omicron, we know that access to information and just sort of getting through the messy periods together is really important. So we want to be available for the media and for our community to answer questions to get through this period. As Dr. Vines said, I really want to emphasize that everyone is doing the best that they can right now in a really difficult situation. We work closely with schools, childcare, businesses, and community groups to focus on the areas that Dr. Vines talked about in this Omicron wave that is, it's humbling. We live in nature, and Omicron and COVID is calling the shots in terms of what our timeline is and how we adjust our response. So while we've been talking about a one-way road out of the pandemic, and what we mean by that is that we are carefully evaluating the strategies that will work or won't work given where we are, we always know that something could be around the corner that changes our response. And this creates a lot of anxiety in terms of what's happening on the ground. So I really just want to acknowledge that people are doing the best that they can in this situation. And we're looking really carefully at how we adjust our response, given that we really don't want to flip-flop back and forth between guidance related to isolation and quarantine, masks, et cetera. So we've really been focusing our efforts, like I said, on supporting enhanced vaccination efforts, specifically around boosters, because we know that that is extremely important in preventing hospitalization and death, and also supporting folks to stay home when they're sick. We know that the isolation and quarantine guideline changes have been difficult for folks, and we're continuing to try and work through that very carefully, as I said, looking at this as a one-way road. The other thing I just wanted to mention is that, and I said this last week in a media interview, we're looking at this period of time and specifically our recovery from COVID as a generation's worth of work. So what we're looking at in terms of indirect effects of COVID, which span everything from impact to children's education, to things like an increase in overdose deaths and other issues that we've seen arise during the pandemic, is that we're not going to go back to where we were before, in that this gives us a very, very distinct look at things that existed, health disparities that existed before COVID that have gotten worse, and that we really need to focus on these different issues alongside adjusting our response to COVID. So that's really what we're focusing on right now. And again, I want to acknowledge that it's a very difficult time because we have to balance out, what our approach is to protecting people's health from COVID itself, but also looking at those indirect effects from COVID, and thinking carefully about continuity of operations in the community, because there are things that impact people's lives that aren't COVID per se, but that can have terrible outcomes. So we're really looking carefully at how to balance that approach, understanding that there are other things going on in the community. And with that, I think we're opening it up.
And if reporters, if you'd like to drop your name in the chat, if you have questions. I know that Lisa Balick from COIN had a question about, local hospitals are just now limiting visitors. Is it too soon to be talking about what's next?
So I'm hearing this question as, given the strain on hospitals, are we appropriate in talking about what might be after Omicron, or somehow suggesting that we're at the peak? I think, yeah, I would be very cautious to say that we're at the peak right now. We often only really understand where we were in hindsight. So it's possible that we're there. Some of the forecasts put it at this week or next week. Again, that could be cases, in which case hospitalizations, trail by several days to a week. So I don't want to make it sound like we're coming out of this. By no means. I think we're very much in it, especially where our hospitals and healthcare systems are concerned. That said, we expect that the curve, the cases, and the stress should come down as quickly as it went up. Just looking at how other jurisdictions, looking at their experiences as far as those who are a few weeks ahead of us. So I think we're trying to stay with the public and with you all to acknowledge where we are now, but also where we may be in a matter of weeks, because Omicron really moves so quickly that we may have really important questions to answer when cases do come down. And there's the moment of really taking stock of where we are in the pandemic, and some really obvious questions about what's next.
Thank you, Dr. Megan Allison with K2.
Hi there. This question would be for Jessica Guernsey. I know that you had mentioned not wanting to flip-flop. What do you see as the short term and the long term when it comes to restrictions?
Well, as Dr. Vines mentioned right now, we still have a curve to flatten right in this moment. Probably the most obvious restrictions still in place or mandate in place is masking. Masking definitely plays a really key role right now and will continue to play a key role. For other restrictions that we've used in the past, if you're referring to things like closures or group size restrictions and things like that, we really don't consider those effective in where we're at right now. Again, back to what Dr. Vines said about the epidemiology of the variant that we're experiencing right now. It's spreading so quickly and it's so prevalent in the community that the damage that would occur utilizing pretty blunt tools really would not have an impact in a way that would have return on investment in terms of mitigating disease spread. So again, right now we're really focusing on some very key approaches: vaccination, masking, and stay home when you're sick.
Thank you so much. Connor McCarthy with KPTV.
Hi there. So I had a question, in regards to when should people go to the emergency room? Because I've talked to a couple ER nurses and they're saying, they're seeing a lot of people come in with mild symptoms. And what's causing some of that backlog is just the triage of these patients. So how can the public help, alleviate this feeling of being overwhelmed in the ERs? And, when is it a good time to actually go to the hospital in an emergency?
Yeah, thanks for this question. I'll start by saying unequivocally, people should not be going to the emergency room for a COVID test. That is not the place to get that done. You can call 211 if you need help locating a test, and we can talk about testing access separately, but the emergency department is not the place to do that. I will say I am actively talking with emergency medical providers, hospitals, health systems several times a week. We are watching for opportunities to potentially ease some of the strain on hospitals. We're very reluctant to push a message of don't go to the ER unless you're really, really sick, because we don't want to discourage people who may be early in their course of illness with COVID or may have something more serious going on. We don't want them to forego that level of care if they need it. So to answer your question specifically, don't go for a COVID test. If you find yourself sick, first work through your primary care doctors or urgent care options, and please use the emergency department as a last resort. That said, don't hesitate if you feel like you're having severe symptoms or need immediate attention.
All right, thank you. And I had one more question. There are some researchers out there throughout the country that are saying, we're going to be possibly shifting into an endemic. Is the county looking at this research and preparing, for this next phase of the pandemic, which is the endemic?
So I think that's a little bit of what we're talking about today. And I'm just going to be real honest with you. I don't like even using the term endemic. As I said before, what we're doing right now is looking very carefully at where we're at. What tools do we have in our toolbox that we need to continue as we learn to live with COVID, which is more how I would frame it. But then also start to pivot our resources and focus on these indirect effects of COVID that are quite impactful. And again, just running through the scenarios of what we've looked at, the impact to children around not being able to attend school or having in-person education intermittently, things like traffic fatalities, overdose deaths, and even the impacts of people not being able to seek regular care for chronic conditions like diabetes or heart disease. So to answer your question, yes, we are looking at what does it mean to live with COVID in a post-Omicron era and balancing the tools that we have and we know that work against the impacts of what those mean to the overall community. So like I said, I don't like using the term endemic. I think of it more broadly as living with COVID, but really focusing on what are those other impacts that we're seeing in the community that need our attention.
All right, thank you.
Demi Lawrence with the Business Journal.
Hi, yes. So I know recently it was announced the federal government would be sending out N95 masks to Americans. And I read that the Midwest, some places in the Midwest were getting those sometime this week. It's not only what I was not only was I wondering, maybe if there's an estimate on when maybe the county would be receiving some of these tests in its local pharmacies and stores, but what the county would be doing to help people looking for those masks who maybe are having trouble.
I do not have specifics on the federal mask distribution process, other than what I've heard myself from the federal government around the direct ability for folks to order both the tests and masks. I think we pushed out some of that information earlier this week on our website, but other than that, I don't know the specifics of the plan.
We are here and taking your questions. Any other questions? Megan, go ahead.
Hi, sorry, me again. So we have heard from districts and I guess this would be for Dr. Vines. We've heard of districts in other parts of the state that are telling families masking is now up to you. We're turning it back to the families. What would happen if schools within this jurisdiction put out the same messaging?
I'll try to tackle that question and then I'll see if Jessica wants to chime in. I think, we've worked really closely with our school districts about COVID precautions really since the beginning of the pandemic, but especially given that our back to school coincided with the peak of the Delta surge. And we have made it an absolute priority to continue in-person learning through the school year. So to be very clear, we understand schools may need to close, for example, if they don't have enough staff to run their operation, but we support keeping schools open and we don't want to see them close to interrupt disease spread. So the masking piece and part of keeping them open and shoring up everybody's confidence in the school environment, whether it's teachers or families, that has been a shared effort around the emphasis on masking and on doing our best to structure the school environment to minimize spread, things like optimizing ventilation, spacing kids out, and really heavily emphasizing masks. So I'm not trying to dodge your question, but it's just something that we've worked so closely on and have a real shared understanding around. It's hard for me to actually go to the hypothetical. Jessica, would you add anything?
Yeah, I have no reason to think that would happen, to be perfectly honest with you, mostly because of everything that Dr. Vines just said and our close relationship and working with the schools around staying on the same page about how to reduce risk as much as possible, and masks still play an essential role in that in terms of continuity of operations for schools and reducing the risk of spread. So we meet with the schools multiple times a week, and that has been part of our conversation. And there is a shared agreement that we maintain that piece of the prevention puzzle.
Dr. Vines, if I could throw one more question at you. We are hearing concerns of this new variant similar to the Omicron variant. How is your team tracking that? And do you have potential concerns watching that right now?
Yeah, what new variant are you referring to?
It is I don't want to mess it up. It's like the B2, similar to the Omicron.
So you can tell by my question, it's not something that we're actively tracking in this moment. Oregon Health Authority, along with OHSU, really look at the full picture of what are the variants that are circulating right now, as best we can tell. And as of last week, it was 95% Omicron. So I know there will, as there's been the entire pandemic, there will continue to be new variants pop up. Some will not turn into anything. Others, as we know, will be something that we need to pay attention to. At this moment, I don't have new variants on my particular time horizon, but I suspect others who follow the technical piece of variants might.
Thanks, Megan. Isabella with the Mercury.
Thank you. Dr. Guernsey, you mentioned dealing with addressing other health disparities that have been made more obvious by COVID during the pandemic. From my understanding, staff at the county level is quite taxed with the current, surge and kind of back at a crisis level dealing with the pandemic. How do you address just staff capacity in wanting to address these other health disparities simultaneously while addressing this current surge and all the work that comes with that?
Yeah, I appreciate that question and really want to appreciate my entire team and staff of public health. I mean, I'd be remiss in not, acknowledging exactly what you're saying. This has been an exhausting 2 years, and public health is a small and mighty group. And folks have really put it all out there to do the best that we can in this global pandemic while we're addressing some of these other really awful issues. So none of that work has stopped. We do have to reposition people in public health to respond to such a huge crisis, this pandemic that we're in. But we are doing parallel work specifically on those issues that I mentioned. But there is a fixed resource, and pivoting some of that requires that we balance these things out. And that's not uncommon. We have multiple things going on at the same time. But it's exactly why we're carefully looking at the situation of what are we doing in response to the continued issue of COVID, as well as working across the public health division and the community on these other issues that have gotten worse. Some of the things I mentioned are particularly hitting Black, Indigenous, and people of color much more disproportionately, particularly around traffic fatalities, overdose deaths, and then untreated chronic health conditions. So we have to figure out a way to do a both and it's not just the public health division, it's the entire community. So that includes healthcare and hospitals. It includes community-based agencies and faith leaders and policymakers, to be perfectly blunt, because the issues that we're seeing arise and getting worse are longstanding issues that are embedded within our systems and are in our larger community. And they're not going to be easy to untangle. But if there is a silver lining from this whole last 2 years, my hope is that everybody will dig in deep so that we can really uplift some solutions to address these systemic issues, because they're not an accident. They're purposeful, they're embedded within the way our communities function. So we have an ethical obligation to pivot to address those issues at the same time we're balancing out our response to COVID.
Rob with OPB? Rob Manning with OPB. Mike is not working. Nick Budnick has a question in the meantime.
Hi, thank you for having us. Dr. Vines, Jessica, I'm curious how you both are feeling about the future. Do you feel like there's a light at the end of the tunnel? Do you feel like we're coming out of it? There's a lot of debate out there in the public sphere, and I wonder how you personally are feeling.
Well, just building off my last response, is there a light at the end of the tunnel? I'll be honest, I'm seeing that more broadly as I do feel like, as stressful as the current wave we're in right now with the variant, the compressed nature of it is very, very stressful and exhausting for myself, for my colleagues, and certainly for healthcare, hospitals, and community-based agencies. So it's difficult to be on this roller coaster. The light at the end of the tunnel for me, though, is the balanced approach, like I was just saying, of how we respond to a continued situation with COVID, but then really digging in deep to address these longstanding inequities. So I don't see it separate, COVID from these other issues. So for me, they are sort of tied together. And I'm energized by the people that I work with and the commitment they have to community health and addressing these issues. So I'm feeling honestly a little bit tired, but hopeful that we will dig in and deal with some of these issues.
Yeah, thanks. I appreciate the question. I think I have a sense of short-term optimism still for spring of 2022. Winter and the indoor season is the traditional respiratory season. It's when most coronaviruses that we know of circulate, along with flu and other things. So I feel like getting into the summer months may give us a reprieve I also just have to remind everyone how amazing the vaccines are. So Moderna and Pfizer have a track record of safety. They have a track record of being effective at what vaccines are supposed to do, which is to keep us from getting severely ill. So that reality, I think, is important to recall. And I think that charts a longer term path through vaccine, through kind of settling into some kind of pattern around COVID that we're able to respond to without the level of disruptions that we've experienced these last 2 years. I can loosely envision that reality. All that said, a new variant could throw all of that off course. And then finally, to Jessica's point, I think, you know, people talk about wanting the pandemic to be over, and I think increasingly we're thinking about it as something that we emerge from step by step, and that really is going to cast a long shadow over health and over many of our social services and many aspects of our lives for many, many years. And so therein lies the opportunity as far as how we emerge from this pandemic and what we decide to make different, so that next time around, and there will be some kind of next time, we're in better shape.
Thank you both.
Thanks. And Rob dropped a question in the chat, wondering if you can discuss how we can accurately identify when we'll hit the peak with so many people getting tested at home or not getting tested and not having those reported results.
Yeah, so I can take a stab. Oh, Lisa, yeah, I was just going to say, I can take a stab, but Lisa's probably better off. Go ahead.
Yeah, sure, I can answer this one. So Lisa Ferguson, Communicable Disease Manager. So, you know, yes, we do look at testing numbers, but there are also other factors that we look at, other data points that we look at to help us determine when we might reach a peak. Some of those are, we look at emergency room and urgent care utilization, so we can see how many sick people are using our urgent cares and emergency rooms, what kind of symptoms they're presenting with. We also look at our percent positivity. So that kind of tells us how many people are getting tested, how many of them are sick. And then we also look at things like our outbreak numbers, you know, how many outbreaks are being reported. And of course, hospitalizations, we know kind of lag. So that gives us a little bit later information. So there are, you know, as I said, those multiple things that we look at. We also look at trends. And so we know that even though our test numbers might be an overall undercount because of home tests or people who don't access testing, we can still look at those trends and see when the trends start to go down as well. And Jen, feel free to add anything.
Well, thank you so much for joining us today. And we will probably be back with you next week. So keep the questions coming. Thanks, everybody.